Hey, you guys, it's Coach, and we're here just to discuss a few more trades. We've already chosen our occupation, but we can always go back and make changes according to our trade walk. So soon we'll have the trades talk to us. But before then, I just want to give you a synopsis of a few. And this one right here is for CNA. The CNA, a certified nursing assistant, is a very important position, and it's really your start to getting into healthcare. And so we know that healthcare has many, many layers. And when you go all the way to a surgeon or a doctor, you're talking about high level work, people that's gone to school many, many years to do high pressure work. When you're dealing with the human body, you got people's lives in your hand. There's really nothing to play about when it comes to that. Then we also have certified nurses. Um, we have registered nurses, and they're all at that next level. But the first way to get into that is to start with CNA. And we offer that trade just to learn all the basics of the human body. We learn how to treat people. We learn how to stay sanitary as we assist people with the healing process. We learn how to identify disease. We learn how to check people into hospital or doctor areas. We learn in the nursing homes or in the private practice areas how to deal with patients and prepare them for what they need before they go into their processes. So we know there's blood pressure, there's taking weight, there's advice on working with people that are sick. You got to remember when people are sick or when people aren't well, they're afraid. And so a lot of the professionalism that goes into CNA is dealing with people that are afraid and comforting them and educating them on what will be happening to them or what has happened to them. And to do this, it takes a good bit of training. Like every other trade, we mark off TARs. Now, of course, going into 2021, there will be some different processes. Every trade will look a little different, but your instructor will guide you along that path. And so when you're finished with all of that great information and you've done your hours, you'll take clinicals, and there'll be a test that you'll need to pass to move on. And once you receive that CNA documentation, you can move out into the field and start to present yourself to grow in that field. So in our My Page, there'll be a lot of jobs: a pediatrician, a podiatrist, surgeon, registered nurse, nurse practitioner, X-ray specialist. There's a lot of jobs in the healthcare field, but it starts with this trade. Then from then, we're going to decide, do we want to go to college? Do we want to go to community college? Do we want to go work and advance through an apprenticeship? What way are we going to reach these goals? But first of all, we need to take this seriously. Okay, we need to take CNA seriously, do our best, ask all the questions you can, especially with something like CNA. There is no time for to be apprehensive about questions. You need to get those questions out there. We have a great staff that will be able to educate you on what you'll see as you move forward. Okay, so that's our next option, CNA, and we'll go on to the next. See you.